you need to know the layers of anterior abdominal wall. So let's say if you are doing surgery, they can give you actually a situation that you are a resident and you're a surgical resident, and the surgeon asks you to start a surgery on a patient, and what will you see in the correct order. So if you are doing abdominal wall surgery, so number one, you will see skin, then superficial fascia, external oblique muscle, internal oblique muscle, and most commonly the question of the content will be about hernia surgery. This is a clue. Transverse abdominis muscle. So skin, superficial fascia, external oblique, internal oblique, transverse abdominis muscle, extra peritoneal fat, and then interperitoneal area. So you need to know them in the order. Peritoneum, this is for your reading. It has parietal layer and visceral layer. Visceral layer is basically covering visceras, and parietal layer is the outer layer of peritoneum. So there are some images. Epiploic foramen is important. It's also called foramen of Winslow. This is the only communication between greater and lesser sac. Now, what are the boundaries of epiploic foramen? So they will not ask you any of these boundaries, but you should know, because there is one thing which they will ask you, which is content of epiploic foramen. That is the most important question. But let's go over the boundaries. Anteriorly, hepatoduodenal ligament and hepatic portal vein. Posteriorly, inferior vena cava. Superiorly, caudate lobe of the liver. Inferiorly, first part of the duodenum. Like I said, they will not ask you about the boundaries. They will ask you the content. So here, this is the epiploic foramen. So during the surgery, you can actually put your finger and compress this gastroduodenal ligament. And this is the only communication between greater and lesser sac. So you can do Pringle maneuver. At this point, you can compress. Let's say if there is a bleeding during the surgery, you can actually put your finger here and compress this area to stop the bleeding. This is called Pringle maneuver. Used to clamp hepatoduodenal ligament and interrupt the flow of blood through the hepatic artery and portal vein in order to control the bleeding during liver resection or managing liver trauma. So you can actually clamp it too. But let's say if the clamp is not available, you can actually put your finger in and apply pressure.